Okay, let's jump right into this explainer. I want you to close your eyes for a second and just imagine something. You're out running with your friends, right? You're laughing, feeling totally normal, just enjoying the day, and then out of nowhere, your chest just suddenly tightens. It's a really terrifying sensation. It's like the simple, automatic act of pulling in a breath suddenly feels like you're trying to suck air through a tiny, narrow little cocktail straw, you know? You immediately start to panic. And the terrifying reality here is that the more you try to breathe, the harder it actually gets. For millions of people across the globe, well, this isn't just some scary hypothetical. This is the very visceral, very real reality of asthma. So what is it? At its core, asthma is a condition where your airways become super sensitive, making it incredibly difficult to breathe. And here's something a lot of people actually get wrong. Asthma doesn't just affect kids. It can happen to absolutely anyone at any age. So here's our roadmap for today. We'll cover what asthma actually is, identifying triggers, what it's like inside an attack, how we treat it, and finally, debunking some common myths. All right, section 1. What actually is asthma? Let's look at the anatomy of a breath. Think of your lungs like an upside-down tree. The trunk is your windpipe, and it branches out into all these tiny air tubes. Normally, air just flows through them without a hitch. But when these sensitive airways get triggered, a sort of three-part biological chain reaction kicks off all at once. First, the airways swell up. Second, the muscles around them physically tighten. And third, a thick, sticky mucus forms inside the tubes. Because all of this is happening simultaneously, that breathing passage just gets smaller and smaller and smaller. And that shrinking passage, that leads directly to some pretty classic symptoms. We're talking wheezing, coughing, chest tightness, and a really intense shortness of breath. And what's crucial to understand here is that these symptoms are notoriously worse at specific times. They love to strike at night, right early in the morning, or smack in the middle of a workout. Now, before we go any further, I want to emphatically clear something up. Asthma is absolutely not contagious. Zero chance. You cannot catch it from someone else. It's a personal, internal condition, not some virus you're going to pass along to your family. Moving on to section 2, identifying your asthma triggers, or what we can call the overreaction button. The source material uses this fantastic metaphor. Imagine your lungs have a literal overreaction button. Basically, something completely harmless enters your body, but your lungs mistakenly react to it as if it's a massive, dangerous attack. They hit the panic button to defend themselves. And ironically, it's that very defense mechanism that shrinks the airways. But what actually hits that button? Well, it varies widely from person to person. For some folks, just walking into a dusty room will cause their airways to tighten up in minutes. For others, it's pollen, maybe cigarette smoke, city pollution, or even just a blast of cold air. Viral infections like the flu can do it. And get this, even intense emotions, high stress, or a really hearty bout of laughter can set off some dubs. Crazy, right? Okay, section 3, inside an asthma attack. Let's talk about the physical experience. People describe the actual experience in a few pretty visceral ways. We already mentioned the whole breathing through a straw thing, but another really common description is that it feels like a literal elephant is sitting right on your chest. Your lungs are fighting so hard, and oxygen is violently struggling to push through those narrowed, mucus-filled branches. So if you're ever with someone having an attack, there are outward signs you'll notice. They'll probably start breathing super fast, often making a distinct whistling sound. They'll struggle to speak in full sentences and might feel really dizzy. And here's the absolute worst part. It's this terrible psychological loop. Because breathing is automatic, when it suddenly gets hard, you naturally panic. And that anxiety, it physically makes the symptoms even worse. That's exactly why quick intervention is everything. Which brings us to section 4, how asthma is treated and how people take back control. Because despite how scary an attack is, the vast majority of people with asthma live completely normal, super active lives. They play sports, travel, build careers. And the absolute foundation of that control is the inhaler. Let's bust a quick myth here. Inhalers are not addictive. They just safely deliver medicine straight into the lungs. There are two main types to know. You've got your reliever inhaler, used for sudden symptoms, to relax those tight airway muscles fast. Then you've got the preventer inhaler, which is used regularly every single day to reduce that underlying swelling and inflammation over time. But hey, medication is really just one piece of the puzzle. Doctors highly recommend lifestyle interventions to work alongside those inhalers. Honestly, just avoiding your known triggers is step 1. keeping your home dust-free, practicing careful exercise routines, doing specific breathing exercises, and of course, regular checkups. All of this combines to keep those airways open and calm. I do want to highlight a really vital warning from the source material though. Never, ever ignore frequent coughing or breathing difficulties. So many people just wave off these early signs, saying, oh, I'm just out of shape, or it's just a seasonal allergy. But doing that is incredibly dangerous. Untreated asthma quietly gets worse over time. You gotta face it to treat it. All right, last up, section 5. Let's debunk some common asthma myths. Fact versus fiction. Let's bust 3 massive myths right now. Number 1, people with asthma should avoid exercise. Completely false. With the right treatment, professional athletes compete at the highest levels of their sports with asthma. Number 2, inhalers are dangerous. False again. They're actually one of the safest, most effective medical treatments we have. And number 3, it's only a childhood disease. As we mentioned earlier, adults can absolutely develop asthma later in life too. So when you put all of this together, we get to this really empowering takeaway. Asthma might affect how someone breathes, but it absolutely does not have to control their life. Understanding early symptoms, figuring out your specific triggers, and getting the right treatment, it changes everything. It literally takes the power right out of the asthma's hands and gives it back to the patient. You know, breathing is something most of us rarely even think about until it becomes difficult. But by simply understanding how asthma works, you're now so much better equipped to support your friends, your family, or maybe even yourself if those symptoms ever show up. So the next time you take a deep, effortless breath, just ask yourself, what other hidden battles are the people around you fighting every single day? And how can understanding their reality change the way we support them?